I'm Margaret Sheehan, this is Chandra Gadsden, and this is Amy Hopkins. And we are Acupuncture Healing Arts. We are Chester County's first nonprofit acupuncture organization. Our application is pending with the IRS, so we'll see when that comes through. We are asking for space to have an acupuncture clinic and a flex space that we would also be able to offer educational classes in different forms of therapeutic exercise. We're also looking for some financial support to help pay the staff, the support staff, and to offer scholarships for those who discover that they want to explore this kind of work as a profession. Our first year budget would be about $59,000. Why acupuncture? Acupuncture and related therapies can treat pain without addictive medications. They can reduce medical costs. They improve physical, mental, and emotional health. And acupuncture practitioners are well-educated healthcare professionals who can support patients in getting and staying healthier, not just treating symptoms. The challenge. I think we all know the challenges of the greater Coatesville area. It's really important to uplift the health of the families in this area and look for opportunities for new career paths and employment. The gap analysis with the closing of Brandywine Hospital, I think we all know that this is a healthcare desert, and acupuncture can be a tremendous source of supporting health, relieving symptoms, and treating diseases. The community acupuncture clinic would offer 3 4-hour shifts per week. We could treat 20 patients per shift. We would have 3 classes a week and determine the classes in collaboration with other community agencies. We would need 1 practitioner and 1 support staff. This model is easily scalable, sustainable, and portable. Our benchmarks would be getting a clinic up and running by September 2023. As I said, the 3 shifts per week, and pair each shift with a therapeutic exercise class or other educational event. By September 2024, we would want to increase the number of shifts and educational programming, establish training programs for future support staff in billing, scheduling, and office management. And we start mentoring programs for beginning acupuncture practitioners. We would also like to offer scholarships for acupuncture students to increase diversity of practitioners. The expenses, we're looking at a startup funding of about $5,000 for equipment, labor and supplies about $54,000, for a total of $59,000. And again, that would provide the 3 weekly shifts, 60 patients per week at a cost of less than $20 per treatment, plus the 3 classes a week. At a full value of care, a clinic like this could generate $1,000 per shift. The market value of this treatment is about $50 to $80 in this kind of setting. There's possibilities for insurance reimbursement, private auto, workman's comp, and care would be offered on a sliding scale fee so that it would make it accessible to more people. The second year, we'd want to increase practitioners, develop more workforce, add mentorship programs, and scholarships to the programs. So we'd be looking at a bigger nut there at about $116,000. But again, we can be generating money from the program with a sliding scale fee and insurance reimbursement. So I'd like to introduce Amy, our office manager, and she would be doing the support staff training.
Hello, everyone. My name is Amy. Not only am I an employee of Acupuncture Healing Arts, but I'm a member of this community residing in Valley Township. To say that acupuncture has changed my life would be an understatement. From an employee standpoint, I began working with Margaret about 6 years ago. Thought this job would be a temporary stop on my life journey, but 6 years later, I'm here with a degree from Immaculata University in Communications and a 4-year-old child as well. I've stayed at a job because it's provided me flexibility, peace of mind, stability, and opportunity. If I never started working with Margaret, I would have never tried acupuncture. I always thought acupuncture was something that was not inclusive for people who look like me. As a Black woman, I've had some pretty horrific experiences with Western medicine, from not being heard and dismissed to being prescribed medicine that my body rejects without trying to find the root cause of the issue. Western medicine, especially in this area, is not always easily accessible or affordable. And as a patient of acupuncture, it's helped me in ways that Western medicine is not. This is Chandra, and she is our insurance billing specialist and acupuncture student as well.
Hello, everyone. As Amy said, my name is Chandra. Acupuncture Healing Arts nonprofit serves as a purpose, that exceeds granting access to care to a population that otherwise wouldn't receive it. This program also supports students and aspiring acupuncturists, such as myself, who have limited resources while pursuing their education. AHA is a place that expands on the teachings acupuncture students receive in their classroom. Having direct access to experienced practitioners such as Margaret grants me the opportunity to receive the support I need to successfully achieve my academic goals while earning a living. Supporting our nonprofit allows AHA to go a step further by offering financial support to minority acupuncture students who struggle to gather resources, and helps to offset the tremendous amount of debt we tend to accumulate in our academic pursuits. The vision for AHA's nonprofit is one that creates opportunities in all areas of healthcare, from patient access to education. Supporting our nonprofit means supporting a community of healing and limiting those obstacles to those, that often disrupts it. Thank you very much for having us and for the opportunity to present.
I got a question. All right, acupuncture. Okay, I'm from here, right? I live up in Valley. Now, how are you selling this to the community? Because, I really haven't heard it. And have you actually reached out to see if this is something that people, since we say it's a diverse community, people of color, although you are of color, there's a little light-skinned lady over there. So my question would be, have you sent out any kind of survey marketing? Would this be something that would be feasible and accepted in our community? And have you had success so far since you've been at this for a little bit?
So I've been practicing acupuncture for 20 years, and for another 20 years before that, I was in massage therapy and taught therapeutic exercises. And so it's growing by leaps and bounds. More and more insurances are covering it. There's more and more research to substantiate it. And my experience has been that when people from Coatesville have come to Westchester to experience the work, they're really moved. But the most reason that people don't continue with this care is that they can't afford it. Because we set up a community acupuncture clinic in Westchester in 2016, 6 years ago, and the price that we set was $50 per treatment. Many people need 2 or 3 treatments to get out of pain. And they'll come in once and they'll try it the one time, but then they don't have another $50 to do it. So having this sliding scale fee would be a way to go. Working with outreach and education, that's the purpose of having classes and open houses and connecting to other healthcare organizations in the community, senior centers, youth centers, really getting the word out is really important. Education is the most important thing to do to share this work. Yes, please.
Sorry, if I can just quickly add. Also, to answer your question, in my class, my acupuncture school, I'm the only person of color in the entire class. So a lot of the limiting factors are pertaining to education. Really, our people just don't know. And as far as chronic illness is concerned, there's a large number, as far as in this country, is African Americans who have chronic diseases. And a lot of them are, quite frankly, tired of medication. That can cause other issues. So I know personally my friends and family who know I'm in school, they're like, I cannot wait for you to graduate because I really want to try this, and I want to see someone who looks like me or who can cater to our community, who genuinely wants to help us. So the need is there. It's just about, as Margaret said, the outreach and just letting them know that there's an alternative, and it's relatively more affordable than the alternative as well.
Also, from an employee standpoint, I have to add, I've worked with Margaret for 6 years. I don't see people coming in that look like us. You know, and it bothers me because acupuncture is so beneficial, but it's just hard to try to get people that look like us into the office. So this is like one of the things that I've been trying to tell Margaret. We need to reach out to people that look like me because.
Is your base in Westchester?
I live in Coatesville, but we're in Westchester, yes. Yep. Yeah, but I mean, Westchester still has a huge community as well, so but we're just not coming into the office.
You know, my question is kind of similar. I'm curious about your marketing plan, and Margaret, and on Amy and Chandra, your comments are very much appreciated. But my questions are about your marketing plan to make the transition from Western medicine to acupuncture.
Well, it's not a matter of making a transition. People can do both. And acupuncture does very well in treating pain and degenerative conditions where Western medicine doesn't do as well. The cost is certainly a factor. We now have an insurance code that so insurance is all based on coding, and there's a code that this person couldn't comply with care because they couldn't afford it. So there's more and more doctors who are referring to us. Medicare is now covering acupuncture for low back pain if you have a physician supervising. So it's a matter of getting out into the community, getting the information out, having it visible, having it, again, a space that is connected to other areas and having outreach. Education has been the key to it. So I would welcome partnership with any organizations that are interested in improving the health of their people and talking about it.
I would agree with you. So this plan is based on putting a center here in Coatesville or close by?
Yes.
And it sounded like you're looking for donated space. How many square feet would you need to make something?
So the community acupuncture clinic we have in Westchester is about 25 feet by 10 feet, and that'll allow 3 people. So if we had a much bigger space, we could have enough room to do it. So I would say, a room a third this size would be plenty. Yeah, so about that kind of space.
I would agree. I think early on, because you're going to need a lot of promotion and marketing, you may want to add something into your budget for that. And then also for liability insurance. If someone's going to give you space, you're going to probably have to make sure that they're insured so that,
Insurance, utilities, things like that would be part of the budget as well. But the really interesting thing is that liability insurance for acupuncture is very, very low. I pay $1,000 a year for that, whereas any physician is paying multiple times that. So it's very low risk.
I just want to say I do acupuncture. I have somebody that I do go to, so I do know about it, and it does work. However, you mentioned the pricing. A lot of people can't afford it, and it is an ongoing thing. It's not just you go for 3 treatments and you're healed. It's an ongoing something that you need to go to several times, and at least 2 to 3 times a week. So pricing, even with your sliding scale, is going to be kind of hard to have people of this community commit to. And also, a lot of insurances don't cover. I know you said that Medicare is, but it is a certain language, and it's a lot of times where your billing people will have to go back and forth with the insurance companies. So, like they were talking about marketing, like how do you plan, like you have to really think about how you want to reach the people and have them come out and do it. Because a lot of us will not try it because it's just like, somebody's sticking pins in me, and then you get blood. From certain areas you'll bleed, and so it is a lot. I think that you're going to have to overcome to get people to trust this way of taking care of themselves and healing in medicine.
Yes, and part of the sliding scale would be a 0. There would be some people who are receiving fee sessions for no money if they didn't have the means. So we would look for funding from other sources as well.
Another round. Thank you so much.